Hi, everybody. It's Olivia with Freedom at the Mat. Thank you so much for joining us again for another episode of Well Chat. Today, we have an important topic we're going to talk about. It's about fibroids and our hormones. And I have a woman that I am delighted that we have come upon. Her name is Dr. Soyini Hawkins. She's based in Atlanta. She's a board-certified gynecologist specializing in hormonal health and its effects on women's emotional well-being. Furthermore, she takes a holistic approach, recognizing the interconnectedness of hormonal balance, lifestyle, and emotional equilibrium. Dr. Hawkins empowers women with information, which is what she's going to do with us today, to truly understand our bodies and take an active role in managing our hormonal health journey. You're so Welcome to Freedom at the Mat. Dr. Soyini, how are you today?
I am lovely. Thank you so much for having me.
Thank you for doing your hair like mine today.
I love it. It's beautiful. We are like sisters. I love it.
So I know you're a very, very busy business owner and practitioner, so I want to get right into it. So let's talk about fibroids, Dr. Soyeni. What are fibroids and where do they come from? Why do they form? What are they?
Awesome. So, yeah, fibroids are tumors of the uterus. Benign tumors, and I say benign because nothing about them is benign in the symptomatology and what they can cause and how they can affect women. But they're tumors, they're benign, they're not cancerous, and they just grow in the muscle of the uterus and can grow on the outside, the inside, in several different locations. All women can have fibroids in their lifetime. And we see it usually during their reproductive years because the hormones that our bodies naturally make as women are what sensitize those fibroids. Some of the symptoms that are most known to be associated with fibroids is heavy menstrual bleeding. Some women have the pain from their fibroids, or what we call bloating or bulk symptoms. But nevertheless, they can cause a lot of symptoms that are even unknown, like fertility issues.
Are they preventable?
Fibroids are not wholly preventable, but there are things that we can do, what I call lifestyle adjustments, right? To help balance some of the way the fibroids might grow, and more importantly, balance the way that they're symptomatic for our bodies. So we can't necessarily prevent them from happening, but we can slow down the growth. Right? We can slow down their impact on our daily life. And in that sense, I think that we can treat them as a preventable disease.
Got it. What lifestyle modifications can we take on to help us minimize their growth? I remember years ago, probably about 8 years ago now, I'd gone to a doctor. I was thinking about having, I didn't say I wanted to have children, I was thinking about having children. And they were like, oh, you have these little polyps. They probably are like little fibroids, but don't have to worry about them. Just make sure that you do X, Y, and Z and they won't grow. And I was like, and I don't even remember what the X, Y, and Z was, honestly, right?
Sure.
At that time, I was truly more concerned about my ability to conceive. But that was the first time I even heard that you can live with them and you could manage them growing. So what are those lifestyle modifications that we can take on if most of us are going to get them during our reproductive years anyway, and especially if we have a hereditary history, what can we do to minimize their growth?
Yeah, so a couple of things that can be done, and it's rooted in how fibroids work, right? How they grow, how we have them in the first place. Remember, I said they're hormonally sensitive. So, our estrogen and progesterone that we make from our ovaries as women is what allow the fibroids to grow and has a lot to do with their symptomatology. So, decreasing excess exogenous estrogen is the biggest lifestyle modification that we know from the research can be quite impactful. Not eating beef and pork, which has a lot of hormones in it, estrogen rich foods that are like soy. Soy is not great in our premenopausal years now. Let me tell you, when I'm in menopause, I'm gonna eat soy every day of my life because it's a beautiful form of natural estrogen. But again, our body does not need that help in the earlier years. Not taking in things that we already know aren't great for us. So those fast foods, processed foods, canned foods has a lot of preservative in it. That's why it has a shelf life, right? That's why they're always like, donate your canned goods. They can last forever. But those are not great for our body and certainly not great for anything that can be sensitized by hormones. Decreasing stress goes a long way in every cell of our body, but we do have great studies that show that stress levels are associated with fibroid growth and symptomatology. So even if they don't grow, but they're causing havoc, right? Vitamin D is a great supplement to decrease the rate of fibroid growth, but also possibly even shrink it now, we know, when you combine it with green tea extract. And green tea extract as a pill, like a supplement, you can't drink enough green tea to get what you need of it, but that combination of vitamin D and green tea extract has been shown in research to help shrink and reduce the size and effect of fibroids.
Amazing. So now I had no idea about beef and pork and things that have hormones. So what about, you didn't mention chicken. Chicken has hormones. Should we do like organic hormone, like the free range chicken? What about that?
If at all able to, right? Because we all know that there are food deserts and it's not
Right.
the same for all.
Right.
If at all possible, it is great to know where your food is coming from. So yeah, trying to get those hormone free, free range, know where your butcher is getting everything.
Got it.
But the meats that have the highest amount of hormones is the beef and pork. So I still eat chicken. I eat all types of poultry. I still do fish and seafoods, but absolutely no beef and pork if you can avoid it. But there are some people who need to live on a spectrum
Right.
and everything in moderation, and they still need a steak every once in a while. That's, that's reasonable. We're human. But if you had to choose something to give up, the beef and the pork make the biggest impact.
Okay, I want to clarify something that's totally personal. I'm a huge tofu person. You'd mentioned that soy isn't good pre-menopause, but once you have postmenopause and menopause, it's okay. So tofu and edamame, are those okay?
So, no, not if you can avoid it. In the premenopausal years, think about the things that afflict our body and their sensitization. So, fibroids, endometriosis, of those disease processes are sensitized by additional hormone. So any exogenous, meaning not what our body is naturally making, anything that we put in our body, on our hair, on our skin that has any additional hormone in it can throw off our body's natural balance. So soy, even though it's so yummy
Right.
in our tofu and our edamame and all of those things, if you can do it in moderation, great. If you can do it not at all, even better.
Okay, thank you. Thank you. I know you're not a nutritionist, but I was like, wait, while I got you, let me ask you about that tofu that I had this morning.
But that's why I also tell my patients you don't have to become vegan or vegetarian. You don't have to give up
Right.
everything in order to do your best for your body towards trying to be on the more holistic spectrum when it comes to your fibroid management. But, like there can be a healthy balance in there too.
So speaking of fibroid management, right? I know this is a tricky question, and this is that I would definitely recommend everybody talk to their gynecologist. If you're in Atlanta or you want to fly in, definitely go support and get info from this particular gynecologist. But let's say you've been diagnosed with fibroids and you've been told that you have to have surgery. Is it true that sometimes the fibroids are just too far gone that you can no longer manage them through lifestyle modifications?
Yeah. Yeah. Unfortunately, as a fibroid grows, because they're tumors and that's naturally what they do, and they can grow anywhere from a centimeter to a centimeter and a half a year. Sometimes they grow even faster, right? So, backing up a little bit, that observation stage when a doctor might say, oh, they're so small, they're not causing any problems, you don't have to worry about them. If they're not following that up with, but we're going to keep an eye on it, then you need to run for the hills. You need to keep an eye on the fibroids. If observation is what you want to do, fine, but we need to do an ultrasound every year at the very least. And sometimes when patients are first diagnosed, we need to do that ultrasound at a 6-month mark. But there is absolutely room to not do anything. On the other end of the spectrum, sometimes the fibroids are so large that they're making an impact even when we don't know it. They could be impacting things like our heart, right? So a lot of women with fibroids have heavy menstrual bleeding, are anemic, and that anemia affects the way that we oxygenate the rest of our body, our brain, Our heart has to work harder. Our limbs and all of our other organs, they need that blood. And if your blood level consistently is low, now you're affecting some of your vital organs. Sometimes the pressure of fibroids. I have some patients whose fibroids grow on the outside. They don't have heavy bleeding, they don't have pain, but it's so large and it's growing so high into their abdomen, it's putting pressure on their kidneys, or the tube that goes from the kidney to the bladder, the ureter. When that urine backs up into the kidney, it damages the kidney. I've had patients that come in my office and they've already lost a kidney, not even knowing it. So again, fibroids can be very symptomatic, but they can also be a little bit tricky and get so large that they'll start to affect other organs. And then it's like, come on, honey, we got to do
Right
something.
now.
The lifestyle modifications won't necessarily save the
Got it.
kidney. Does that make
Yeah,
sense?
it totally makes sense. That's why I asked the question, because it's like I'm one of those that I don't do any pharma. And I'm one of those like you
Mhm.
would have to probably lock me up, chain me to something for me to like take any type of pills. But I
Sure.
also am aware that sometimes there are some medical situations that are just beyond lifestyle modifications. And I know there are a lot of other roots rock reggae girls just like me, right? That are just like, no, I'm gonna have some tea and some sage and burn some incense and some water, right? That's me, right? So I'm like, but sometimes it's beyond that. Okay, so I know that you are a big advocate and proponent of hormonal well-being and overall emotional wellness. Can you tell us what sparked your interest in your advocacy for hormonal well-being and emotional well-being?
Yeah, it's interesting because I've fashioned my practice now. I'm primarily a surgeon. That's how we started off this conversation talking about fibroids, because that's the heaviest part of, I mean, fibroid and pelvic wellness center. That's the name of my
Right.
practice. So it's near and dear to my heart. But what I have found for myself on my personal fibroid journey is not enough of that discussion of how we can balance our bodies, our hormones, to help with our self sense of well being, just as women in general. So when I was able to kind of curate what type of practice I wanted to be, what type of impact I wanted to make in my immediate community, but just for women in general that might encounter my care or just need some care, need some guidance. I thought that understanding our body, what our hormones are doing, how they impact us, how they impact not just ourselves, but again, that sense of well being was an extremely topic to sit heavy on, because I don't think we have enough of that conversation in general with our doctors and our providers.
So, what does it even mean? Like when you talk about balancing our hormonal balance and emotional well being, what does that mean? And if you were to give any of us who are unfamiliar with that language, that terminology, an actionable step for us to begin to balance our hormonal balance and our emotional well being, what would that step be?
Yeah, I think it's important for women to know when it comes to hormonal balance, um, it's they need to be validated in that. How you're feeling emotionally, that can be set by your hormones, but also how your body is behaving, everywhere from your weight management to your brain fog or your ability to concentrate to your gut health and your GI tract. All of those things can be impacted by your hormones. So when you're feeling a little bit off in one area of your life and you're like, does this have anything to do with my body and my overall health and well-being? Probably does. That don't erase that, don't dismiss that, don't neglect
Right.
that. Yeah. So first things first, be able to recognize what is normal for you, what is normal, period, what is balance for you, what is balance, period. And that all sits very differently for us. Some of us are that would, stereotypical type A personality, go, 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 go. And some of us are more mellow. Both extremes are absolutely okay. But knowing when I feel off, I feel like something's just not right, being validated in that and having a safe space where you can go talk to someone about it to see, okay, how can I get some help here is extremely important. And we all deserve that.
So digging deeper there. So if I'm a go 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 person, which I am, but I'm working on not being, right? But I am, and all of a sudden I'm starting to feel lethargic and I don't want to get out of bed. That's what you mean. If it's like the opposite of how you normally are. Okay.
Yeah. Because then you're questioning, okay, what's going on? And everybody around you is too. What's going on with Olivia? Is she all right?
Right,
She good?
right. Okay.
Yeah. Hmm.
What are some common misperceptions about hormonal balance and emotions, and how would you address them?
I would say some common misconceptions about hormonal balance and emotion is that um, something has to be wrong with us if we're expressing ourselves as women. We tend to, in being the female sex, be labeled as emotional in our decisions, emotional in our movements and how we interpret the world and attack things. And it's not just that. Our hormones play a huge part, and again, every cell in our body. And I'm going even beyond just our female hormones or our sex hormones, beyond even just our estrogen and progesterone, which does impact every cell of our body. It's not just our female organs, right? That's why when our patients are transitioning from perimenopause to menopause to postmenopause, their joints start to ache, right? They feel like they can't concentrate and um, do as much tasks as they may have been able to do 20 years ago. And that is because of the shifting of their hormones. It's not because they're emotional, and it's not because they're unbalanced and they're not capable. It's a real thing. Our thyroid affects our body. It affects the cells of our body. It affects how we generally feel. So absolutely a connection there, but we should not be limited by that or thought to be uncapable, right? Incapable of whatever the right word is of excelling because we're considered to be emotional beings. Our balance of our hormones is a thing, but it can absolutely be adjusted, especially when you have someone to kind of hold your hand and walk you
Now
through
that's
it.
what I was going to ask you, right? I think we've all seen exaggerations, especially that men do, like, oh, I don't go near my girl when it's that time of the month or whatever when she's pregnant, like these like exaggerations. But for women, some women who they truly might be out of control during different elements of their life, whether it's the time of the month or whether when
Mhm.
they're pregnant or postpartum, right? What advice might you offer practically for women who cannot seem to get a handle on balancing their hormonal fluctuations?
Sure. So I would first question, are they doing the least to get the most? Are they sleeping well? Do they have good sleep hygiene? Are they decompressing in the evening? Are they turning off the TV and putting down social media, right? Are they getting some healthy nutrition in their body? Are they taking in good fruits and vegetables and grains? What are they feeding themselves? What are they feeding those cells in that muscle and whatever is feeling off? And then also, what is their movement like? Are they getting in any exercise? If they're not a gym girly, fine. But are you taking a walk? The weather is changing. Are you getting a little vitamin D? Are you in the sun? What are some of the very basic things that may help? Yeah, that may help balance us. I think balance is a key to finding that good place and good space when you feel off. What are the things that make you feel happy? Do you feel, safe in your space? Do we need to go to the movies today? Do we need to just put the computer down and take a break? If there are things that can be helped, can we help them? Can we eliminate some stressors? So those I would say are some kind of just, it feels very basic, but high impact things if we can adjust. If we can get one more hour of sleep, it does make a
Great. So
difference.
then, my final couple of questions. If we were to create, because we want all of our freedomettes to be well women, and this is a well chat with you,
Mhm.
if you were to prescribe a hormone wellness prescription or a hormone harmony hub for us all to be able to go and access it, can you give us 5 things that should be in every well woman's harmony hub for her hormones?
Yeah. So the first thing that I would say should be there is the ability to be seen. Yeah, to be validated in your concerns and what your unique journey is wherever you are in your health, right? And your hormone health and your wellness overall, especially as women. You want to go and seek a space, a hub, a provider that is going to see you. The other thing is you should be able to come armed with something, know what your patterns are, kind of maybe have, but very basic. What is your menstrual cycle like? Can you tell them, what was happening last month and the month before and the month before that? Because that goes a long way, especially if we're talking about hormone balance and health. And then I would say be open. Yeah, be open to give, but also to receive. Maybe you'll learn something new that you didn't know. That was simple. Some of my patients come in, they're like, "Oh, I didn't know about green tea extract. I drink green tea," and they get a little excited that there might be a connection there that can be helpful for them. So, but you have to be open. You can't necessarily come in and immediately shut the door. And I think that us as providers, when our patients come to that safe space, into that hub, we should make it so they are feeling like they can trust us and listen to the recommendations that we might have, right? It starts with the other two first, though. We have to validate, and we have to hear where they're coming from, what their concerns are, before we can jump in and say, this is what you got to do.
Right.
My patients don't get, this is what you're going to do from me. They get suggestions. They get things that are going to be tailored to the 30-minute discussion we've just had of you explaining to me what's going on. And then, 4 and 5 is action. You have to leave wanting and knowing there's more that can be done, or feeling that you've gotten sometimes not just validation, but reassurance. Some patients come in and they just need reassurance that you are okay, that everything is all right, that we good, and we have a plan. And if there have been action items given, to actually take action when you leave. I am really, 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 like, raise my hand, bad at that. I'm not the perfect patient. Sometimes I know what I need to do and still don't do it. I know I need to take some probiotics, but I still don't do
So being empowered to take the
So
action.
that follow through is extremely important too. It's not just when you go to the doctor. It has much more to do with what you do when you go home.
Excellent. So, Dr. Soyini, you have been so insightful and provided so much free advice for our Freedom Mats community. My question for you now is, if anybody wants to get more information from you, do you have existing resources or any upcoming projects in which we can support you and just get information from you around fibroids and hormonal wellness?
Oh, that's awesome. Yes, absolutely. So I absolutely love opportunities like this. And I thank you. Thank you so much for your platform. Thank you for what you're doing for women, period. I enjoy being guests and being invited to share what I think is extremely personal to me and ministry to me. I do think that the work that I do is ministry because I see myself in all of my patients. So platforms like this is extremely important, helpful. I do a lot of podcasts and interviews and talks, and national TV, local TV, all those things. So I'm always about the business of educating. And then certainly I'm on Instagram and social media as Soyini Hawkins, MD, and I do try to put a lot of information on there that could be helpful, and resources as well. And I know you said if someone's out of town and they want to see me, I do virtual. So I have a lot of patients that will call and just schedule to speak with me virtually. I'm a surgeon primarily, so most of the time patients are calling to see me to discuss their fibroids or their endometriosis or their cysts, or they have a complex history or surgery that no one else wants to touch, and I'm willing to walk them through it. Even if you're out of state of Georgia, I'm happy to speak with you. And then lastly, my website, I packed it full of educational information. Getfibroidhelp.com or fibroidandpelvicwellness.com. That's a great way to just read on all of these things that we've discussed today
We
as
are
well.
so grateful to you, and just it's wonderful when you meet people who are genuinely about the work. And I love that you consider it to be a ministry. So thank you for spending time with us today at Freedom at the Mat and all Freedom Mats. If you have any concerns about not only your hormonal wellness, but fibroids in particular, this is the woman to talk to. So definitely check her out on all her platforms. Her information will be in the description below.